Menopause doesn't start at midlife, it starts years earlier. In today's episode, I'm joined by a physician who specializes in menopause to break down the early hormonal transitions, how they influence metabolism, muscle, mood, and recovery, and how intentional exercise, adequate fueling, and smart training choices now can protect our health and resilience both now and in the future. I selfishly wanted to bring on an expert in the field of women's health, specifically as it relates to menopause, in order to help us better understand that stage of our lives as women. So I'm very, very excited for our guest today. She is a board certified physician with extensive training in cosmetic and regenerative medicine. She is the founder and owner of Bespoke Medical Aesthetics and Wellness, a clinic specializing in menopause, hormonal health, and aesthetics. Welcome to our Wellness Girl Chat with Dr. Larissa O'Neill. So I selfishly started this podcast for one main reason, and that main reason was to get girls starting to think about what changes happen within their bodies before they come to that stage, before they have to actually react. So I want people to be a little bit more preventative in how they think about their bodies and what's happening within their bodies before they're actually going through a certain stage. So we've covered a lot on the menstrual cycle, on pregnancy, on postpartum, but something that we haven't covered a lot about is perimenopause and menopause. And I feel like it's this Wild West thought in our heads of we might get there eventually. We don't really understand what happens when we go through that phase of our lives. So that's why I'm grateful that you agreed to come on and help us just better understand and educate us on what happens within our bodies during perimenopause and menopause and how you go about treating women in perimenopause and menopause. So let's start with the basics. What actually happens within our bodies when we are hitting that stage of menopause?
Okay, so average age of menopause is about 51. Perimenopausal symptoms will start 7 to 10 years before that. So a lot of women in their late 30s to early 40s will start to feel just not like themselves. They may be more tired. They may not sleep as well. They may not be as effective in the gym when they're working out. They may have some brain fog, muscle soreness, joint soreness, itchy ears, frozen shoulder. The list is actually very long, and that's because everybody responds to their hormonal shifts differently. And it is like a roller coaster ride. Some women don't have a lot of symptoms. A lot of women have significant symptoms. Anxiety, depression seem to get worse. ADHD gets worse. Again, women just don't feel like themselves. And it can start as early as your late 30s.
Is there certain criteria that have to be met in order to know, are we in perimenopause? Are we in menopause? Or based on what someone comes to tell you, you're like, nope, you are in that stage? Is it more of like your expertise that goes into deciding that?
Yeah. So perimenopause is really symptoms and age.
Okay.
If a 20-year-old came to me and said, I have these, we'd be talking about something else. But if you're in your 30s or 40s and you come with symptoms, it's basically that. Checking hormones in perimenopause, testosterone is one that we can check because it declines in a different way than estradiol and progesterone do. But if you're checking somebody's estradiol, it's just a snapshot in time, and it could be completely different 2 days from then. So in perimenopause, it's really symptoms. Menopause is lack of estrogen, lack of progesterone, and technically, clinically, no period for a year. But you're going to get symptoms long before that.
So what happens within our bodies? You mentioned hormones decrease. Can you explain that a little bit of the process that our bodies go through physiologically with menopause?
Yes. Up until, let's say, mid-30s, your estradiol and your progesterone are pretty stable. You get specific variations throughout your menstrual cycle. When you get into your later 30s, early 40s, the brain and the ovary are not as good at communicating. Basically, your ovary is trying to figure out how to output the estradiol. So your brain will produce signals, LH and FSH. They're just two signaling hormones. And they go to tell your ovary, hey, produce estradiol. If your ovary's good at it and your adrenals are good at it, then your brain's happy, the rest of you's happy. But as we get older, we're not as good at producing the estradiol. So everything gets a little whack. Testosterone's a little different. Women's peak testosterone typically is mid-20s, and then we get a steady decline from there. You get some variation, but it's a pretty steady decline throughout the decades. So that pretty much by the time women reach perimenopause in their mid 40s, women's testosterone levels tend to be fairly low. And again, estradiol can be anywhere from very low to very high.
So, with some of those hormonal shifts, is that what causes some of the symptoms that women experience or?
Yes, all
Okay.
of them.
Yes.
So we have estradiol, testosterone receptors everywhere in our body: brain, bone, muscle, bladder, pretty much everywhere we have those receptors. And so when things start to get wacky, we get symptoms. Again, not every woman is as sensitive to them, but most women are going to have some symptom. They may not equate it to, I'm in perimenopause. They may just think, I've got little kids and I'm running around and I'm tired and I'm not sleeping as good because I have little kids, but it's usually hormonal.
And are the symptoms that I get related to my genetics, or what part of menopause, whether it's the time that we hit it or the symptoms that we get, is any of that related to genetics, or is it really no one kind of knows? There's
I,
no
I,
pattern.
I would say no one kind of knows. I do always ask, hey, when did you start your period? When did you
Yeah.
start your cycle? When did your mom start it? When did she go through? You can gauge, but every woman's different. Every woman's got a different ovarian reserve.
Are there environmental factors that can put someone into menopause, or has that not really been studied?
There aren't really studies on
Okay,
that.
yeah.
We know currently that there are a lot of what we call endocrine disruptors in our
Mhm.
society, and those certainly are going to play a role. We see lower we see lower testosterone levels now than we used to
Mm.
because of endocrine disruptors, and women are the same. I think we just have more variability now because there are things in our environment and in our diet that affect us more hormonally than we used to have.
So, moving to a little less sciencey, a little less nerdy, moving more towards what the everyday woman might experience and notice within their bodies. What are some of the physical changes that women often see when they hit menopause when it comes to aesthetics, body composition, skin changes, fueling? You mentioned exercise capacity. What are some of those common changes that women are challenged with in menopause?
It's a lot. Estrogen and testosterone both help us keep collagen around. They help keep our muscles strong. They help keep our visceral fat and subcutaneous fat levels low. So when testosterone starts to decrease and estradiol starts to get wacky, we start to lose collagen in our skin. So you may notice drier skin, wrinkles start appearing. We start to replace our muscle with fat, which is very discouraging. We start to build visceral fat. A lot of women will start to notice that they gain weight around the middle, that they're not as strong as they used to feel. But collagen plays a big role for skin health. And we do see, because at the clinic here, we do aesthetics as well. We see a lot of women who have not been on hormones who have not as great a skin as they would like to, simply because collagen is gone. Vaginal dryness is a huge one, and that can start in perimenopause. And again, estradiol keeps the vaginal tissue moist and healthy, and collagen there keeps everything happy. And when it goes away or starts to get wacky, that's a big symptom that women come in with. So physically, women usually will report dry skin. Weight gain is a big one, especially around the middle.
Given some of the physical things that women experience, how do you approach it from a physician lens as a way to guide your patients, whether it's through supplementation, medications, behavior modifications, education? What sort of stuff have you seen work really well clinically and then is also really research backed when it comes to handling some of these challenges?
Yeah. So we do a lot here. We do blood work. We test a lot of biomarkers. We do body composition testing because when you think about perimenopause and menopause and the changes that happen with the hormones, a lot of that is that we get a lot less metabolically healthy. So again, we get visceral fat, we get fat buildup in our muscle, we get less insulin sensitive. A lot of women will come in and say, I haven't changed a darn thing. I eat the same, I work out the same, I've gained all this weight. What's going on? So we do body composition testing on everybody. We measure their muscle mass, their visceral fat, their percent body fat. And I don't even care about their weight number as much as I care about those three things. And it's very interesting for some women who, when you look at them physically, look like they should have a low body fat percentage, but they don't because they've replaced some of their muscle with fat and they have a higher visceral fat load. than they expected. And it's all because of those hormonal changes. So we do body composition testing. We do a lot of blood testing to look at different, just like even vitamin levels, like vitamin D. Let's take vitamin D. We call it a vitamin, but really it's a pro-hormone. It helps us with all of our other sex hormones. So if a woman's vitamin D level is low, one of the first things we're going to do is say, you got to get that vitamin D level up. And it needs to sit around 70. And most of the time we check it and it's usually around 20. And people are like, but I'm outside all the time. But you are, but it's still not enough. We don't have enough in our diets anymore for most people to really have really good level, again, which needs to be around 70. Plays a role in bone growth for women. Osteoporosis is a huge thing that happens for women as they go through menopause. And actually, it happens before that. So I want to back up a little bit. So I've actually started talking to women a lot earlier, and I wish that primary care physicians, even pediatricians, would talk more to young women about exercise and protein intake. Peak bone density for most women is around 20. It starts to decline after that. So I've had 2 women come into me with premenopausal spinal fractures from weightlifting because they said, I'm going to go get healthy. And then so they start lifting weights and they get a compression fracture or stress fracture. We start them on testosterone and a little bit of estradiol, and bone density improves over a couple of years. But if we started to talk to younger women about the importance of this, we'd see less of that as they went through menopause. And maybe it's different with kids now. Like my daughter lifts weights, but she lifts weights because we talk about lifting weights. I don't know how many 21-year-olds get that talk from somebody that this is really important for you. But muscle health and bone health, very important. Muscle health because, again, it keeps us metabolically more healthy as we go through life. And perimenopause and menopause are just times when women get very metabolically unhealthy. So we talk a lot about body composition. We talk a lot about protein intake because, again, protein intake needs to be different for women. Our body doesn't deal with it the same way men does. We have to have a certain spacing of it. We really need 3 meals a day with a good amount of protein, and women need at least a gram of protein per ideal body weight, especially when we're in menopause. So I like women to break it up, and let's say your ideal body weight is 120 pounds. You need 45 at breakfast, 45 at dinner, and the rest at lunch. So higher protein intakes at the 2 ends of the day, really better for muscle synthesis for women. So better protein intake, different exercise. Most women are really good about cardio. They'll go out, they'll take a walk, they'll get on a treadmill, they'll get on a stair step or whatever. But that doesn't help you build muscle. And so talking to women about weightlifting, everybody that comes in, we talk about it. And not just lifting, but lifting heavy. Really trying to keep your muscle mass around and build it if you don't have it. Because muscle is the organ of longevity. If it gets unhealthy, which it does when women go through perimenopause and menopause, we just don't age as well. We don't do as well. Protein intake, exercise are 2 of the big things we talk to everybody about. Making sure that your blood work looks good from a vitamin and mineral standpoint. The biggest supplement we probably put everybody on is vitamin D just because it's low. And then we start talking about hormones. We do a ton of hormone replacement here. Estradiol, progesterone, testosterone. There are lots of different ways to get it replaced. Testosterone, I think, is huge for women. Again, we've got androgen receptors everywhere. Muscle, bone, brain, bladder. I start a lot of premenopausal women on testosterone. It does help alleviate a lot of the symptoms through perimenopause because you do get some conversion to estrogen, estradiol. And then if they're very symptomatic from lack of estrogen, we'll do some estradiol in perimenopause at lower doses. And then once they get into menopause, we do full doses. But it's really about trying to stay strong, metabolically healthy, eat right, really watch body composition, and then address the hormones.
What about when it comes to skin health? Is there anything that you guys like to do or recommend when it comes to skin health?
Hormones. Yeah.
Okay.
So estrogen deficient skin is a real thing. If you're not on systemic hormones, there are estradiol, estriol face creams that you can get compounded. We also talk a lot about the lasers that help you build collagen because there are some very good ones out there. And then good medical grade skincare. One of our favorite ones that we sell here is Pavise. because it has so many amazing adaptogens and antioxidants in it that help your skin repair. And then some kind of retinol or acid type product that again helps you build collagen. I love copper, GHK copper. I think it's all over Instagram right now, but you can use it topically. You can inject it. It's a peptide. It is amazing for collagen build in skin. It takes time. Everything does, but it is one of our favorite peptides to use for skin. But it's a good combination of good medical grade skincare, a really good sunscreen. I cannot stress sunscreen enough. I know I'm a redhead, so I talk to everybody about it, but any coloring in your skin is sun damage, sunscreen, and a physical block over a chemical block. So something that's a zinc for sunscreen. And then lasers that again help with sun damage and help build collagen. There are the class of, I'll call them fillers. They're really biostimulators, Sculptra Radius and Bellafill that really help you build your own collagen. So we do a combination of all those to build out a plan. We're not just a one and done kind of thing. For us, if a woman's coming to see us and they come to see us for a skin consult and they're not on hormones, we talk to them about it because your skin's not going to age as well if you're not on some kind of systemic hormone. And there are very few women that hormones are contraindicated for. Very few.
You said you can start them, maybe not preventatively fully, but like when people first start showing symptoms to help with some of the symptoms. This is a very probably elementary question, but do y'all taper off too? Is there like a ending phase that you guys taper off? Or is it once a woman is in menopause and starts to have some of these changes, they really are changes that are going to have to be managed for life?
It's permanent, right? It doesn't, once you stop hormone replacement, all of your benefits go away. And the benefits are many. Luckily, the FDA removed the black box warning from estradiol 6 weeks ago, which was huge because those of us who have been in the space for as long as I have been know what the science is and know that we should have been using hormones all along. We should have never stopped because of that one silly study. We know heart prevention, dementia prevention, osteoporosis prevention. When you look at the leading causes of death for women, heart, hip fracture, dementia, and the hormone replacement, menopause hormone replacement really does help prevent all of those things. So we're huge proponents of it.
Well, and like you said, hormones, there's receptors on all different systems within our
Yep,
bodies. So
exactly.
there's probably not a system that it doesn't benefit, especially if that was how our bodies normally functioned in our 20s and 30s. We're still going to have some of those receptors. So how can we maximize their reach when we can no longer produce what we used to be able to? Yes.
Yep. So I have 80 plus year olds on hormones still because they want to continue to reap the benefits and they feel good on them. And if they have tried to stop them in the past, they're like, I don't feel good. So we just keep them on. No reason to stop.
I love what you said too about just different education and guidance that you give your patients, because as a PT, I'm a huge muscle building, bone mineral density. How can we shift the viewpoint early on, especially in girls that working out is for aesthetics, which yes, it can be. And
Yes.
that's confident building. Like I do the same thing, but how can we get more of that long-term view of, yes, I see patients all the time who have muscle atrophy, who have bone mineral density issues, and then they're going to become fall risk later on and have that fracture and lose some of their mobility and some of their function. And knowing that's even more important in menopause. And I don't know if this is a good way to put it, but our bodies are not necessarily working with us as much as they are in our 20s when we can maximize some of that bone mineral density and some of that muscle, our muscle mass too.
Yes.
That peaks in what, 30s, early 30s. And then it's
It gets,
the graph for increasing the linear, the slope is a little less. So it's how can we work to build what we can when we're younger, because that's when we can really build that solid foundation and then continue to work towards that in our 30s, our 40s, our 50s, when our bodies, again, are maybe converting that muscle to fat a little bit, but we have to work a little harder for some of those benefits.
Yeah, exactly. We need to be doing more education in younger women. And it's funny because when I started doing it here with my late 20-year-olds, they would kind of look at me and I'd be like, I promise this is coming. And if we can just do something about it now to help you be better from a muscle standpoint, from a metabolic standpoint, menopause is going to be easier. So
I call it the longevity fund. It's like putting in little habits every single day, whether it's exercise, a mindfulness thing, hydration, fueling the right way, enough protein. I've noticed so many more of my patients healing better after injury, having a better mindset when it comes to a mental health challenge or a challenge that their families are going through. There's just these little things that we can do early on to help us when we're older. And I think coming from the medical field, we see that, and maybe it's more of a fear-based motivation for us to be like, no, I know what I can do preventatively to help me whenever I get to even pregnancy, postpartum. Our bodies go through changes then, but menopause as well. So it's, what can I do now? Knowing what I know happens in these later stages of life, how can I help my body, and how can I transfer that mindset to other girls too, to realize you can do all the cardio, yes, if you love that, but build the muscle, build the bone mineral density, do the jump training to have some of those long-term effects. So
Exactly. Yeah. And training does need to change, right? Throughout your life, your body responds to things different. Menopausal women really need to do sprint training, like true sprint training. And that's because of the effect that HIIT exercise has on cortisol for women, which affects our insulin level and everything. Our stress response is different because of our hormonal challenges. A true sprint exercise is going to be better for us than a HIIT exercise. Cold plunge for women, and there's not a lot of science behind cold plunge in general, but for women, not good. Intermittent fasting for women, again, not good. We lose lean muscle mass. So for us, again, we need that protein in the morning for our muscles. So don't fast till 6 o'clock at night. Sauna is much better for women, and the science on the health benefits from saunas is good. It's really there. So I encourage my women, if they've got access to one, to do it, because I just think it's
beneficial. Yeah.
us.
When we did the cold plunge episode that'll come out next week, it was talking about how cold plunging for women, if you're going to do cold plunging, it's not the colder the better like we think for men. It's more of our bodies sense the cold as a bad stress and kick on our bad stress response. And I actually mirrored it to fasting, because fasting, I've had a PhD researcher, dietitian, like physiologist, exercise physiologist, who studies some of the metabolic effects that women go through and all of this. And she was saying for fasting, our bodies sense the same thing, where it's like we go into this survival mode a little quicker when our bodies sense this lower energy availability. Both with cold and with fasting and things like that, our bodies as women handle it differently than men and sense that bad stress a little earlier on, where men might think of it, or their bodies sense it as more of a good stress and adaptable stress that they can grow from. So I just thought it was interesting. Cold and fasting, it's like both of these things are very popular right now, especially intermittent fasting and fasted training, fasted exercise, all of those sorts of things. So it's just interesting to link those two and to have the women's health and female science be showing some of these differences between men and women. I think it's awesome.
Yep. I think it's great. It's studies have been needed for a very long time. My background's primary care, and the thing that I always remember, because again, we always think about heart disease and how women present differently than men. I had this one patient come in, and she just said, I get short of breath when I get to the top of the hill. And that's new. And I did an EKG on her in my office, and she was having a heart attack in my office. But men come in with crushing chest pain. Women don't, right? But that's, again, the studies haven't been out there. We're now starting to see some of them, which is great. Happy that we have people who are focusing more on women's health, because we are very different than men.
Totally.
Very different.
From our metabolic capacities to thermoregulation when it comes to sauna and heat. And yeah, I love that. I love learning about that and actually like seeing some of the differences. I also think with probably the women that you're seeing right now who are in that perimenopause, menopause stage, it's a little bit of a mindset shift that you're having to coach them through too, because I think younger women are starting to understand the importance of strength training over cardio for some of these aesthetic changes. I bet there's a heavy sort of like mindset shift, because a lot of my loved ones, like my aunts and my older women in my family that I look up to, their exercise has consistently been cardio, and thinking of cardio for fat loss. It's like cardio burns fat. That has been the mantra that people have had for years and years. And then having to understand the shift of, okay, hang on, our bodies handle that a little differently. That might be great for men, but we might need to focus on something a little differently as women, or have a little bit of a different ratio when it comes to that sort of thing.
Strength training is huge. You have to think of your muscle as your metabolic regulator beyond your hormones. They're very important, but your muscle basically controls your insulin sensitivity. So if your muscles aren't healthy, you're metabolically not going to age as well. you will gain weight, you will lose strength, and weightlifting will definitively help that. We really try to build these plans for women. It's not just, hey, come in and get some hormones and you're going to be good. We really do a ton of education. We talk about how to address the visceral fat. We talk about how to address muscle mass with all of those other things that aren't just the hormones. But replacing women's hormones is of huge importance when we look at how to really help women age better. So we talk about it all. It's a complete plan. We talk sometimes about peptides. There are different peptides that we use that can help address visceral fat differently and muscle gain differently. But that's after we've done everything else and somebody's doing the workout and they're eating like they should and they're taking their creatine. We know creatine is all over Instagram right now, but the science on creatine for women is actually very good, not just for muscle, but for brain health. The studies that have come out on Alzheimer's, and when the Women's Health Initiative study came out and it really deterred hormone use for women, the rates of Alzheimer's went up tremendously. But we know that's not just related to hormones, it's related to creatine, it's related to omega-3 levels declining in women's brains as they get older. Some of the things that are really important to talk to women about: omegas, creatine, vitamin D, hormones, all of that. Just because women are far more likely to get Alzheimer's than men, and without hormones, even more likely. All that's to say that there's a lot to talk to women about as they age, and you need to be seeing somebody who will take the time to really talk to you about all that, because sometimes educating yourself on Instagram isn't the best idea.
And I love how you're talking about the foundations. It's, yeah, we can do the peptides, we can do other treatments on top of it for your skin health and things. But what I'm also hearing is like the foundations are the same that we should be focusing on throughout life. They might shift a little bit, but if we can reset a little bit or teach someone who's maybe new at it and struggling with some of the challenges that come with menopause, if we can teach them good exercise habits and routines, good fueling, good supplementation, all of those sorts of things, maybe help them with their sleep a little bit.
Sleep is super important, and it gets very disrupted in perimenopause because progesterone is our sleep hormone. And when progesterone goes away, we do not sleep well at all. And not sleeping affects cortisol, insulin, all of that. So we do focus a lot on sleep health. I have a lot of patients that have wearables, and I say that's great as long as it's not distracting to you. I have one I wear sometimes, not consistently, but get a little data and then I go on my merry way. But sleep is huge, and progesterone is very important for that. And so we do replace progesterone early for a lot of women because they're not sleeping. The 41-year-old will come into me and say, I don't sleep at night and I'm falling asleep in car line. Okay, I know what that is, and we can address that.
Sleep is one of those where I feel like a lot of women, whether it's hot flashes or different things that they experience at night too, sleep seems to be disruptive. And knowing how important sleep is for just recovery, muscle building, brain health, and if we can help with that in some way, and like you're saying, if it's through hormones, because of course hormones affect every part of our system, then why not help that earlier on? That way people aren't struggling with some of these sleep disturbances that is negatively impacting all of the other work that they're putting into their bodies in general too.
Yeah. Interestingly, when women's testosterone starts to go down, they'll start to get night sweats. So when women wake up just drenched at night, it's usually because their testosterone is low. And again, that's an easy fix.
I love y'all's approach too, because like you said, attacking it from every single angle. And I was able to walk through y'all's clinic before, which is amazing, and seeing all of the ways that you're touching every single system within the body, because our hormones affect every single system within the body, is absolutely wonderful. On the topic of creatine and supplementation specifically, have you noticed a difference in dosage needed for creatine when women hit menopause? I know one of my friends subjectively has experienced more bloating, and bloating is oftentimes something that people worry about and are concerned with. And she has said, I know the research says that water retention is not a thing, but in my body, that is what I'm feeling. So is there a shift in how our bodies manage creatine once we get to that age?
So I think people bloat with creatine or they don't. And that's just, again, everybody's body's a little different. You can get some water retention with it. You can get bloating. I think the biggest thing with creatine is you've got to drink water with it. So if you're somebody who I had a friend tell me, she was like, I just throw the creatine on my tongue. And I'm like, okay, one, it's usually so chalky. Like you actually get that down, but Secondly, you really need water with it for absorption. And if you're good about drinking a lot of water with it, you're going to get less bloating and less water retention in general. 5 grams a day is a standard, right? That's what we need. The studies that came out on Alzheimer's were actually done with 15 to 20 grams of creatine a day. You have to be really good about water with that. And somebody needs to be monitoring some blood work on you if you're going to do that high of a dose of creatine. My recommendation is usually just 5 grams a day. If I have somebody that I'm really trying to get some muscle on, like they really have low muscle, I'll tell them to do an extra 5 grams on the day that they lift. Like after they lift, do an extra 5 grams, but just standard 5 grams a day.
Have you seen someone who is putting in the behavior modifications with the exercise, with the eating right, who has maybe declined hormone replacement therapy?
We do have some women who choose not to do hormone therapy, which is fine. It's everybody's personal choice. I usually will direct them to certain resources to try to influence them to take it, but you can do it without hormone replacements. It's just not as easy. It gets harder to build muscle, like you talked about, as we age anyway. So when your hormones go away, it gets really hard. You have to lift exceptionally heavy to maintain and build muscle when you're in menopause if you're not going to be on hormone replacement. It's also a lot harder to address the visceral fat that happens. Again, you've got to be diligent about what you're doing in the gym and how you're eating, what you're eating. Hormones just make it easier because the effect they have on our muscles and on our fat distribution and on our insulin sensitivity. It just makes it a little easier.
So we've talked a lot about a lot of different parts of the body today, about menopause, about perimenopause, about just being a woman in general. Is there something that you wish girls in their 20s and 30s knew? And we've touched on it a little bit, but what would be maybe your top 1 to 3 things that you wish younger girls understood about their bodies at this age to help them in perimenopause and menopause?
Protein intake and weightlifting. Those are really the 2 things that every woman in their teens needs to be educated on. If you can get your eating habits good, if you can get the protein intake right, if you can build that muscle and that bone density when you're young and maintain that, not that it's going to make perimenopause and menopause a breeze, but it's going to be easier. It's just in general going to be an easier transition because you're going to go into it more metabolically healthy. So you might not gain as much weight. The belly bulge that happens will be less. Your risk of osteoporosis is going to be less. It just, protein and weightlifting, the 2 most important things a 20-year-old could be doing right now.
I love that. So consistent with what we're trying to teach women and educate them on earlier on. So thank you so much for joining us. I learned a lot. I know this was something that I selfishly wanted more people to understand about menopause, myself included, and perimenopause, and just what happens within our bodies, why it happens, what we might expect to change, how we can work to not necessarily prevent, because that's not the case, but be more prepared for it once it does hit us. So thank you so much. I will leave the link to Dr. O'Neill's clinics below, her clinic in Georgetown, if you are in the Austin area and know someone or are someone who might want to come see her for her holistic approach to just being a woman and going through perimenopause and menopause in all of the stages. So I hope you guys learned a lot from her. I know I did, and I will see you guys again on the next episode of Wellness Fixes the Pod.
Thank you.